Hello, everybody, the students. Today, you hear more about gender equality in global public health. This is our fourth lecture. Sorry. Okay, you already know this picture. We discussed it during the last lecture, but and here we have again, gender equality and rights to health life, which is SDG number 3. And this is what we will talk about today. Gender equality, rights to health life, good health and well-being. Now, gender equality, by now you should understand what it is. It is about the empowerment of women and girls. And this was central due to the 2030 Agenda for Sustainable Development and all 17 Sustainable Development Goals. It's part of it. Now, good health and well-being, what is it about? Ensuring health and well-being for all at all ages. That is important. This is not only about gender, it is for everybody. And it is important because there are some diseases, no matter whether it's disease, men or women have this disease, and they are also called rare diseases, which do not, there are not too many patients who have it. And for them, it's very difficult to get medication, to get treatment. And this is also part of good health and well-being. It also includes other SDGs, for example, when it's about working conditions or pollution. This influences also SDG3. So we have synergies again, but good health and well-being are very important to achieve many, living conditions, many SDGs. Otherwise, when you are not healthy, you cannot work, you cannot take care of your family, you cannot go to school. It is very important to be healthy. And so, as it's explained here, it has challenges for women, men, girls, boys, and gender diverse people. And so the synergies are very important, and it has achieving good health and well-being has an effect across all of the SDGs. And the better the health of people is, the faster we can achieve the SDGs. Now, therefore, WHO, and that is a new word or abbreviation, which you probably know already, WHO is World Health Organization, which belongs to the UN. And World Health Organization, as the name already implicates, it is about health. This organization takes care of health worldwide. And WHO says that SDG3 and SDG5, they are dependent on each other. It's about the synergy. Without strengthening gender equality in the health workforce, for example, the universal health coverage cannot be attained. We will hear later on what means universal health coverage. But, when you think of female nurses, female doctors worldwide, it is so important that there we have the gender equality, that nurses are treated the same as female nurses, treated the same as male nurses. Female doctors have the same working conditions as male doctors. So we need gender equality in health workforce to achieve good health and well-being. And therefore, WHO says there shouldn't be discrimination, and no one should be left behind, leaving no one behind. That is a very important expression, which we will see later on also for the universal health coverage. And this is regardless of gender or sex. Everybody should have the possibility and the opportunity to live a healthy life. Now, this is an interesting number. This comes from the UN. It will take 135.6 years to achieve gender equality in the economic, social, and political spheres, or even 36 years longer than before the pandemic. So again, 135 years plus 36 years longer to achieve gender equality. And that was, this is calculated by the UN, and it shows which impact COVID-19 pandemic has on the sustainable development goals, and especially here on gender equality. And there are some more detailed numbers, which we will look at now, and that is depending on to which countries we are looking. So this gap, gap until when we will receive, or how long it will take to reach gender equality is, for example, in Western Europe, it is 52 years. In North America, it's 61 years. And in Latin America and the Caribbean, it's 68 years. So you see, in a way, Western Europe is still best when it comes to gender equality. This has to do also with working conditions, because when we look at North America, in North America, the working conditions are not as good as they are in Western Europe, and especially for women, they are even worse than for men in North America, and this makes the gap even larger in North America compared to Europe. And when we look to other regions, we see in Sub-Saharan Africa, it takes 121 years to close that gap. In Eastern Europe and Central Asia, it takes 134 years. And in East Asia and Pacific, 165 years. And in the Middle East and North Africa, it takes 142 years. And in South Asia, it takes 195 years. Without going into details, but this has also something to do with religion. As we all know, it depends on some, on religion, whether girls and women are accepted, whether they have better chances to go to school, to have health care, to receive health care. This depends also on religion. And therefore we have for example, in Middle East, North Africa, and South Asia, the gap will be closed even in much longer time than it is in Europe or North America or Latin America. You can read them. There is a report. I gave you the source here. In this PDF, you find much more explanation about bridging this gap or even closing that gap for women. Now we go a bit more into the question, the pandemic, COVID-19, and why is it so important even through the pandemic to maintain good health, because as you all can imagine, there is a problem, a much higher problem to get more health care because of Corona. Because when we look here in, for example, in Germany, we have the intensive care units. The ICUs are mainly occupied by COVID-19 patients. And doctors are occupied by COVID-19 patients, and the whole healthcare system is just looking right now at COVID-19 patients. And therefore, other issues and topics in healthcare, such as reproductive health, maternal health, child health, is it goes behind the COVID treatment, and so in many countries these topics, which are typical female topics, are not as important anymore, because there are not as many nurses and doctors anymore available for these important topics of women and girls. So we still have to think that we should not forget reproductive health, maternal health, and child health. This is still very important. Now, even, life expectancy has, is now shortened because of the pandemic, and therefore it is so important in every country not to forget and to maintain good health, because otherwise there will be, again, the percentage of women which will be affected by the pandemic because of the shortened life expectancy, because of not enough doctors and nurses available for their problems, for their health problems, will have an effect on women's health, on children's health. One example is, for example, when there is a tumor, it might be a breast tumor, a breast cancer tumor, and a woman realizes there is a knot in her breast, and she knows it, and she wants to go to hospital to have the tumor diagnosed, whether it's really a tumor, whether it is a malignant tumor, and whether this tumor has to be, whether she needs surgery or other treatment. Nowadays, no matter in which country, when you go to see a hospital and tell them about your suspected breast tumor, they will tell you, come again in a few months, because now we are so occupied. We have no free capacity to look at your suspected breast tumor. And it can happen that after a few months, it's too late for that woman. And so it's not only people are dying because of Corona and the statistics of life expectancies decreases, it's also because other diseases will not be diagnosed and treated anymore. That is a big problem. And again, it's very often women have no possibility, especially in countries where there is already bad health care for women. It's during Corona, it's even worse. Now, and we already discussed that, health workers, they are in short supply in many regions, and where there are already not enough health workers, and now we have Corona. It's even worse, because they don't have time to treat other diseases than corona anymore. And there is an example. In Northern America, we have 150 nurses and midwives per 10,000 people. In Sub-Saharan Africa, and we have an average of 10 nurses and midwives per 10,000 people. And now we have the additional disease of corona, and these 10 nurses have to share their workforce, not only for the, let's say, normal patients, but for the additional patients of corona. And therefore you can understand, or will understand, that it's very difficult for women and for everybody, but especially for women, to get the treatment and the diagnosis they need. Now, we already talked about universal health coverage. The UN and World Health Organization says we have to scale up investment in universal health coverage. Now, what is universal health coverage? You already heard this expression, leave no one behind. So, invest in health system for all. Universal health coverage is for the entire world. It's universal. And it means it is a campaign from the UN, from the WHO, because it means that all people have access to the health services they need when and where they need them without financial hardship. It includes the full range of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. Again, here you have the source where you can read more about it, about universal health coverage. Now, what does it mean if I compare, for example, I compare universal health coverage in Germany and universal health coverage in, let's say, the country in Sub-Saharan Africa, in Ethiopia? There is a big difference. Universal health coverage doesn't mean the same access to health services in every country, because that is not possible. But it should allow every person in a country to have a certain access to health services. This will be more or access to more health services in Germany than it will be in Ethiopia. But when you look at Ethiopia right now, or other countries, yeah, when you look even, I know Mongolia, in Mongolia, it's also, I mean, of course, you have a certain access you have in every country. This is in Ethiopia, this will be, or it is in Mongolia, and it is also, even in, when you take Yemen. Yemen is a failed country, a failed state, where there is war. That's the same for Syria, where there is a kind of civil war, and not many hospitals exist anymore. Many doctors left the countries. Of course, there will be a difference in access to health services. And but nowadays, in certain countries, there are the very poor people who have no access at all to health services. And that should not be the case anymore by, let's say, 2030. By 2030, everybody should have a certain access to health services, even if it's only a basic one, but it should be available. And when and where they need it, without financial hardship. And that is also important, because in many countries, healthcare is a business, a pure business. You can even go to rich countries, to industrialized countries. Healthcare is a business. Go to the United States, Go to, for example, United Arab Emirates. Healthcare is a business. It's not a business when you look at Germany. In Germany, we have health insurances, and we have that system of solidarity. That means I have to pay for my health insurance, yes, even if I don't see a doctor, even if I'm not sick for many years, I have to pay health insurance every month. And in Germany, every person has to pay health insurance. There is no exceptions. But let's say there will be another person, a patient, who has a very severe disease. Let's say they need a heart transplantation, which is very, very expensive. And this person pays the same amount, let's say, or let's assume that person pays the same amount of health insurance as I do. But it's so expensive, a heart transplantation, but still this patient will not have to pay for the heart transplantation because it will be paid by the health insurance, and into the health insurance I'm paying even if I'm not sick. And so this is solidarity. We have other types of health insurances, which is a possibility to reach universal health coverage, to start health insurances or implement health insurances in every country. When you look at the United Kingdom, they have the NHS, which is a tax-financed healthcare system. So people are not paying into a health insurance, but they finance the health care by tax, by higher, let's say, for example, higher value-added tax, higher tobacco tax, higher alcohol tax. And this money, this higher tax, goes into a pool from where the healthcare is paid on a national level. Therefore, when you go to a hospital or a doctor in the UK, which belongs to NHS National Health System, then you don't pay for treatment at all. And that is also, they already reach universal health coverage because everybody can go to a hospital without paying. Of course, what they have is in the UK, also in Germany, if you want to have an even better treatment, then you have to have a private or an additional private health insurance. Then you get a better treatment or from a better expert or specialist and whatever. Yeah. So universal health coverage is also about health insurances. It's about health insurances in poor countries. And it can start with a small amount of money, which is paid by people, or by, let's say, a 1% higher tax, which is paid, let's say, value-added tax in Ethiopia, in one of the poor countries, and you pay it into a pool. The pool belongs to the government, and now it's very important. It's about good governance and no corruption. The government should not take any money out of that pool for something else. This pool money should be only for health treatment. And then that could be a possibility to reach universal health coverage, even at different levels in different countries. Now, it is important. We ask the question, why is it important to maintain good health through the pandemic? It is important to maintain good health through the pandemic because it is important to have healthy women. Healthy women will be able to take care of themselves. Healthy women are able to take care of their families. And healthy women will reach gender equality. And in the future, we will reach gender equity for everybody. So therefore, it's so important to have healthy people, healthy families, healthy women. Thank you for your participation. And our next lecture will also be available for you, recorded on Case.io. Thank you and goodbye.